State Representatives Warren Chisholm and Richard Raymond co-authored House Bill 1876. It creates the Texas Health Care Access Fund, which they say will increase the number of doctors practicing in underserved areas.
Now, two state lawmakers from that region have proposed legislation to try to make up the financial difference to doctors who commit to serve in high-need areas.
Many clinics are having trouble recruiting doctors.
Leaders gathered this morning to address a growing problem in the Brazos Valley, a doctor shortage. On today's agenda, House Bill 1876. The legislation would help pay off student loans for health care providers who agree to work in underserved areas of the state.
Providers and some of their patients are speaking out today about a shortage of doctors in the Houston area. They will ask state legislators to pass a bill that would establish the Texas Health Care Access Fund. It would help doctors and other health care providers pay off student loans, and in return, they would have to make a 4-year commitment to practice in underserved areas.
Right now, many East Texas counties need additional doctors and physicians assistants at community health clinics. East Texas News' Donna McCullum tells us why they need the help and how a bipartisan plan is addressing the statewide health care shortage.
The lobby of a community health clinic is full. Behind the doors are health care providers, but not enough.
We need this. We need this hook, for want of a better term, to be able to get people to come to our centers and to come serve folks in health professional shortage areas.
We're here to just say that the city supports this bill, HB 1876, and any bill that will promote increasing primary care providers in our Houston clinics. We know there's a shortfall, and we're here to say that we support any bill that will do this.
Right now, it takes 2 to 3 months to take on a new patient, and the problem isn't money. It's a shortage of primary care physicians. Now today, this clinic and others in the area got behind proposed state legislation that would create an incentive for medical students to become primary care physicians. It's House Bill 1876, the Texas Health Care Access Fund.
Another equally shocking statistic is that nearly half the counties in the state of Texas do not meet the standard of having at least one physician for every 3,500 people. Now today, a show of support was held at the clinic known as Su Clínica Familiar in Harlingen for House Bill 1876.
Something needs to be done to fix a critical shortage of doctors. They used a Heights area clinic to push a bill now in the Texas House that would help establish a health care access fund to address the problem.
Lawmakers are also working on a bill that would help medical professionals pay off student loans. Laura Neal has a story.
We've been challenged for years to get providers in our medically underserved areas.
Central Texas health officials say they need doctors in rural areas, but those doctors have big college loans to pay off.
The bill would help physicians pay off student loans in return for practicing in an underserved area for 4 years. Currently, the Sun City needs dentists, family practice doctors, and pediatricians.
As a clinic director, I often speak to recent graduates of medical school and dental schools, and they tell me that they have an interest in serving communities of low income. But because of their educational loans, they find it necessary to pursue other opportunities that are more lucrative because they have this financial debt that they have to manage.
Se trata de la propuesta de ley 1876 presentada por el representante estatal Warren Chisholm, y Mónica Navarro nos acompaña con todos los detalles.
Así es, Osvaldo. De hecho, contar con un médico de cabecera es clave no solamente porque conocerá mejor su historial médico, sino porque, de acuerdo a las últimas estadísticas del sector salud, cada vez menos médicos familiares quieren practicar en Houston y a lo largo del estado.
The legislation would help healthcare providers pay off student loans in exchange for practicing in underserved areas.
I grapple with the decision as to should I go somewhere where I know I'm going to make more money and I'll be able to pay that, or go where my heart really is.
More than half of the 254 counties in Texas currently need an additional primary care physicians, including Dallas and Tarrant counties. The shortage of doctors has forced some clinics to stop accepting new patients.
Texas is dealing with a shortage of doctors. Today, local health care providers, patients, and community leaders are pressing state lawmakers to pass a bill that would bring doctors to rural communities. Dallas and Tarrant counties are designated as 2 of the most critical shortage areas.
The legislature could bring more doctors to people living in urban and rural areas of Texas. Today in Austin, lawmakers presented House Bill 1876. They say it would create a fund to help medical students pay off their debt
if they choose to become primary care physicians in underserved areas of our state.
The bill circulating on the Texas House floor would put more doctors in rural hospitals, filling a void that's deepening around West Texas. Sarah Snyder has the story, all new at 6.
If you try to make an appointment here at the Crane Memorial Hospital, chances are you'll have a long wait. They're down to one doctor serving the entire county.
If you live in a rural town with few or no healthcare professionals, you've probably run into the problem State Representative Warren Chisholm is trying to fix.
The bill would pay back student loans for doctors and nurses and other healthcare professionals willing to work their first 4 years out of school in a rural town.
Borderland residents gathered yesterday to address the shortage and to urge lawmakers to pass the Texas Healthcare Access Fund.
It's estimated Texas is in need of about 4,500 primary care physicians. If a House Bill 1876 becomes law, it would help medical students pay off their debt if they choose to become a primary care physician in an underserved area.
Some say a severe doctor shortage is causing big problems in parts of Texas and not just in the rural areas.
I'm going to start by listening to your heart, okay, bud?
Dr. Stormy Williams keeps busy at the Martin Luther King Jr. Family Clinic in Dallas.
I was going to do nose.
Okay. Nose! So busy that patients have to wait longer than they should.
It's kind of hard for us to get the patients in as they need to be seen.
We're asking that legislation passes as soon as possible.